We have a lot of videos on our channel. This is a great case. We haven't posted this case. Come on in, come on in. We need it. Come in. Okay. This is a great case. There is a condition. There's a condition. Come on in. That's called Freiberg's infarction. Excuse me, infarction. Condition, Freiberg's condition, Freiberg's this. This is an avascular necrosis. AVN, avascular necrosis. Death. Lack of blood supply. Historically, it could be any of the metatarsals. The most common, the second. We have a patient who has who reached out to me over the weekend. I have the report of the MRI, Dr. Wagner. The patient had already pain for how long? How many weeks? 3 weeks of acute pain. Immediately ordered an MRI, and she actually texted me before I even had the report that verbatim. MRI findings are consistent with a subchondral fracture of the second metatarsal head, representing early Freiberg's infraction. We're here to save the metatarsal head. I commend the patient, right, for obviously reaching out quickly. The patient is in our office quickly before the holidays. What could ultimately happen is that the metatarsal head, try to bear with me here, guys. The metatarsal head, that's how metatarsal head, this is the normal contour of the metatarsal head. This can happen. It becomes like a pancake because when the bone dies, it's a lack of blood supply. We don't walk on our hands, we walk on our feet. All the pounding every single day, basically. You end up with a metatarsal head that from the side normally will look like that. And now you have something that looks like that. I'm not kidding. It flattens out like a pancake. It's not there yet. We're still here. We're still in salvage mode. To maximize improvement, minimize any long-term complications. Patient has had other conditions where we have implemented PRP, platelet-rich plasma. She's done great. We're going to go ahead and perform an ultrasound-guided platelet-rich plasma injection into the metatarsal head to give it the oomph factor, to deliver those growth factors, to deliver those important cells that aid in helping, regenerate this problem. Without further ado, let's go. Sebastian.
Yes.
Let's just keep an eye on her. A lot of people are asking who is, who's Sebastian? Remember I posted that the other day? You're in the feed, right?
I am now.
Oh, you didn't see? Oh, a lot of people are asking. He doesn't know.
No.
He doesn't know. People are asking who's Sebastian.
Yeah.
I'm not kidding.
That's cool.
That's cool.
That is Sebastian.
That's Sebastian. So I have my ultrasound here. Okay, give me 1 second. I'm looking at the screen there. So what I'm basically doing is I'm looking at the screen, and I'm not showing the screen because patient's name is on the screen. We want to make sure we don't disclose names, any private information, right? HIPAA. We want to be compliant.
Yeah.
Okay. Here we go. PRP. Sebastian, I would come from this side right here. Sort of from here. PRP. We've isolated a total of 2. I think 1 should suffice. But I'm looking that the arrow to abajo, to the right. Eso. No, ese. Sigue. Good. Now I can see better. Thank you. So perfect. The ultrasound on my left hand, I'm looking at the ultrasound monitor. Patient's already numb. We're gonna find out. That one?
What? Yes, it hurt.
Okay, so the skin is not numb, so let's hope. Let's hope a little bit. Okay, so I see the needle there. If I'm talking to the patient now, if you're wondering, it's right there, that shiny little thing. Okay? Mira ahí. Pain? Okay, so the patient has no pain. Apparently, the skin was not numb, but everything else is. That's the good news. So I'm infiltrating very, very slow. You can see right there, I'm talking to the patient that's looking at the monitor, that there is expansion of the tissue. Okay?
In the middle of the 2 white things?
Exacto. Un poquito más a tu mano derecha. Okay. Now I'm going to redirect a little bit. Okay, here we go. Pain? Good. Pain? Good. You're doing great. Okay. Super. We're done.
Todavía?
Yeah.
A little bit, yeah. I wanted to marinade. Okay, so 2 things. The skin was not numb. It's my mistake. I'm human. We went ahead and infiltrated more than anticipated. We put in 1.8 cc's out of 2. Okay. The treatment, this is initial. Immobilization is the key. Dong, the ugly boot. It's not Gucci or Prada, but it works really, really well.
Okay. Thank you.
Like always, Freiberg's infraction, people call it differently, different names. An avascular necrosis of the metatarsal head. Interesting case. Unfortunately. www.jawspodiatry.com, Instagram, Dr. Telegram, Jawspodiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Have a